everyone, and welcome. Thank you for joining me. Today, we'll be discussing some practical strategies for educators and providers when navigating puberty education. So, a little bit about myself. I am a school social worker working in a special education setting with fourth and fifth graders. I have been practicing as a licensed master social worker since 2022. And before working in schools, I have past experience working as a trauma therapist and an advocate for survivors of sexual abuse. I currently reside in Rochester, New York, where I was born and raised, and I'm working on my doctorate in social work from the University at Buffalo. So I know you may see this next slide and roll your eyes or laugh it to yourself and skip through it, but I truly think it's important when we're engaging in professional learning to start with resetting and grounding ourselves. I don't know what your day has looked like or what time you're watching this, but I know that we are all exhausted, and at times life can just really feel exhausting. It feels like, especially now, but we can also sometimes dread learning something new that we should be implementing into our classroom or our practice routines. And I have been there. I'm definitely still there with you all in the thick of it. But I want to take a couple grounding breaths together to set an intention to learn today and find at least one thing that we can take back to our setting and start integrating into our classroom or our practice. So let's pause and set an intention for this learning together and take 3 to 5 deep grounding breaths with this image, really breathing in as it gets bigger and out as it gets smaller. So I'll pause for about 3 to 5 breaths. So feel free to return to that slide if you feel you need some more breaths to really center yourself to show up with your best self today. So before we begin, I want to review the learning objectives for our time together. So learning objective number 1 is that participants will identify the key components of puberty education and differentiate between puberty education and sex education to ensure clear and developmentally appropriate instruction. Number 2, participants will apply trauma-informed strategies to create a safe and inclusive and supportive environment for discussing puberty with students. And finally, number 3, participants will leave with tangible tips for integrating effective puberty education into their classrooms or practice, including topics like engaging caregivers and promoting healthy peer relationships. So, a little overview of what our time is going to look like together. We're going to discuss a little bit about what puberty is and spend some minutes defining puberty to make sure we're all on the same page for the rest of our learning together. We're then going to discuss specifically what puberty education is. Puberty education often gets lumped into that larger sex education curriculum, so we're going to sift out and specify the difference between puberty education and sex education. We're going to discuss the need and the why for puberty education. So, having an intentional conversation around that why and why is this something that needs to be talked about? And then we'll move into discussing an overview of some practical tips for teaching puberty education. I'm then going to introduce the concept of trauma informed puberty education and what that looks like, and how the 6 guiding principles of trauma informed care can be directly and tangibly applied to puberty education content. So, it's really important to stress before we go any further that teaching this content isn't just to check the box of some regulation or maybe some mandate that you have. It's truly about giving information that's necessary for students to know and learn about themselves to fully thrive and succeed during this transitional or this awkward phase of life. So, to keep things a little interesting and keep you all engaged, I have incorporated some myth and fact questions to really test your knowledge on this before we dive into the content. So there are going to be several questions fully integrated throughout this webinar to test your knowledge on things. So our first one is it myth or fact? Puberty typically begins between the ages of 13 to 17. So this is a myth that we're going to learn about on this next slide. So before we dive into puberty education, it's important to make sure that we are all talking about the same thing with the same terminology. So what is puberty exactly? Puberty can be defined as a developmental phase that all humans, regardless of gender, go through as they physically and sexually mature. It consists of physical changes, emotional changes, hormonal changes, and developmental changes. So, puberty has historically been documented to occur between the ages of 8 to 14 years old, but has recently been seen occurring more often than 8 years old, which is a phenomenon called precocious puberty. So, it's really important that, like I said, it occurs often between the ages of 8 to 14, not that 13 to 17 on the previous slide. So I also just have a quick note that I have cited on the slides that in-text citation for the material that I have on each individual slide. But at the end of the presentation, I also have several reference slides with the entire citations if you want to do your own future research on this material. So I encourage you all to get out a blank piece of paper or some blank document that you can open onto your computer because we have several reflection questions throughout the webinar to really get you thinking about how you want to incorporate this content into your practice. So I know I often engage in professional learning or go to conferences and I think about how I want to directly apply these techniques that I'm learning. However, when I get back to my school, I often forget what they were. So these questions are really meant to provoke thought, and I'm going to leave several minutes on each slide to give you time to answer. So I encourage you all to pause this webinar if you need further time for these questions, and I truly want you to be intentional with your answers as you are the only ones that are going to see these answers, and they're really intended to help you create and put your own spin on puberty education and really personalize it for the content that you're going to be teaching. And I want this to reflect what this is going to be like for the youth that you're doing it with. So, to start, I want you to spend a minute or two answering what your experience with puberty was like growing up, and maybe any experiences that you went through that you wish someone had warned you about or educated you more on. So, like I mentioned, I'm going to pause for a minute and give you a chance to answer these questions. So, again, I encourage you to pause if you want to spend some more time on those specific questions. So, now that we're all on the same page and we know what the definition of puberty is and what it means, let's talk a little bit about puberty education. So, puberty education provides knowledge and skills to help youth navigate the changes of puberty positively. These are changes such as physical, emotional, and interpersonal. Puberty education programs can be embedded within that larger health or sexuality curricula, or they can be their own freestanding curriculum. Puberty curriculum ideally should consist of education around physical changes, cognitive development, and positive views around personal safety, gender, sexual development, diversity and equity, social values, and relationships. The goal of puberty education is to provide medically accurate information around puberty and also to include the social aspects and changes that occur during puberty. So, these transitional years are some of the most biologically, socially, and emotionally demanding time in one's life, and puberty can really explain why they're feeling what they're feeling. So, engaging in this education helps to validate their current emotions and can alleviate the anxiety they might be feeling around these experiences. So, truly giving them this education early on can help to alleviate any shame they may be feeling that something's wrong with them or that something's happening that maybe shouldn't be happening within their body or within their mind. So, I'm going to pause for another minute to allow you to answer these next questions. So, what are some emotions that come up for you when thinking about teaching puberty education? These may be anxiety, fear, or excitement. So, just your initial emotions that you have around this material. And then, what are some challenges that you anticipate when teaching puberty education? These may be questions a student might ask that you just don't know how to answer, or maybe things that just come up that you're unsure how to navigate. So I encourage you to answer this honestly and reflectively. And I encourage you to look back at it at the end of the webinar and see if any of these are still challenges that you foresee happening that you feel unequipped to dealing with even after participating in this learning together. So, our next myth or fact question is one that I already have hinted at, but myth or fact? Puberty education and sex education are synonymous with each other and consist of the exact same material. This is a myth that we're going to talk about in this next slide, really deciphering between puberty education and sex education. So I want to specify that puberty education is different from sex education. And for the purposes of this presentation, we'll be focusing primarily on puberty education that's given as a freestanding curriculum and not one that's embedded into that larger sex education or health education curriculum. So it's important to decipher between the two because when puberty education is embedded within other programs, it creates challenges for determining where that puberty content exists, so where it starts and stops in the material. And also, it's difficult to measure the effectiveness of the programs. However, puberty education and sex education often overlap in content, as puberty education is a small subset of that larger sex education curricula. So, where we talked about how puberty education consists on the physical, emotional, social, and cognitive changes that occur during puberty, how it helps students learn to take care of themselves during puberty, and teaches why their body emotions are changing, as well as hygiene skills, communication, healthy relationships. Sex education includes all of that. However, is also includes things such as STIs and HIV, pregnancy, birth control, and sexual behavior. So, when they're taught as separate curricula and separate interventions, it allows puberty education to start earlier than some educators and families may be comfortable with that sex education starting. So, some families might not be comfortable with their students engaging in that puberty education at third, fourth, fifth grade. However, when you separate it, they truly can engage it in that without receiving also that sex education material. So I know I've also mentioned that term students several times, and I'm just using that because that's the setting that I'm currently working in and the setting that I'm most familiar with. However, I recognize that you all do not work in schools. So just know that that term students that I use can be synonymous for youth in any setting that are engaging in this material in your own practice or your own agency. So, myth or fact? Less than 25% of public elementary schools in 2019 provided some level of puberty education. So, this is a fact that I'm going to touch on now. So, I do truly want to talk about the why. So, why puberty education and why is this a topic that we're talking about? Why is there a whole webinar on it? So, as I mentioned earlier, puberty is occurring at younger ages than before, which I mentioned is called precocious puberty. However, schools have not changed their puberty education to align with this research showing this increase in precocious puberty, or they might not teach this content at all. So, in my specific school, I mentioned I work with fourth and fifth graders. However, they don't start engaging in health class until seventh grade. So, they're starting puberty earlier in third, fourth, fifth grade. And that's a large gap of time that they're going through these experiences and not receiving education on it until seventh grade. So, in 2019, only 21% of public elementary schools provided some level of puberty education, which was typically embedded within that larger sex education curriculum. So, due to this, many youth were left feeling underprepared or feeling alone to navigate the complexities of all aspects of puberty. So, puberty education can also be all inclusive and can really shift out of that set curriculum that they're sitting at their desk engaging in, but can also move into hands on training or equipping students with the skills needed for puberty, such as the importance of learning how to apply deodorant, is just one example. I'm going to talk about several other examples later on in this webinar. So some might ask the question, like, why aren't parents doing this? Or why is something that must be done in schools because I'm doing this with my child at home, right? So it's important to truly teach this in schools so that all students are receiving the same message. It reduces the stigma and ensures that all students are learning and engaging in these concepts. So without a comprehensive puberty education, students can be left feeling alone, feeling anxious, or have misconceptions around this material. So often, students are not receiving this material at home, so school is the only place that they're going to learn about it. However, with this education, it allows students to make informed decisions about their physical, emotional, and social well being. It allows students to begin building healthy habits earlier based on facts rather than assumptions or rumors. So, a little bit about my own why with puberty education and how I got interested in this directly. So, like I mentioned, I work with fourth and fifth graders, and I see time and time again how my students are starting puberty and they have no basic knowledge around anatomy and why all of a sudden they're having these increased emotions and they see that their previous coping skills are no longer working. So, as a social worker, I took interest in this and teaching them these basic skills and equipping them with the knowledge to better understand the changes that their mind and body are going to go through over the next few years. So, now that we have some general information out of the way, we've discussed terminology and the importance of puberty education. I'm going to spend some time talking about 10 tips to provide effective puberty education. So, you might find that some of these tips are things that you already do in your own practice or in your classroom, but they are definitely important to emphasize when talking about a comprehensive puberty education. So, tip number one is to provide safe and supportive spaces. These may seem obvious, but you want to create environments where students and youth or your clients feel physically and emotionally safe and feel comfortable asking questions about their body and puberty. So, this probably wouldn't be a conference room in a school or a waiting room or an auditorium that feels stale and formal, but you can do it in your own classroom or office if that's a place that feels warm and inviting to students. If you're a related service provider or a social worker in a school, or you're an outside provider, like I mentioned, this can be done in your office or a therapy office at a school. So if you're doing this in a group, I encourage you to arrange the seats in a circle or a semicircle to promote more open discussion and allow for open space for conversation. So some other ways to ensure safe and supportive space that aren't just your physical environment are setting clear expectations for respect and confidentiality. You want to establish guidelines. So maybe you're doing this in a group setting where you already have guidelines or classroom guidelines or group guidelines, but it's important to review them and maybe add special ones specific to this content. So, another way that I like to break the ice a little bit is get all of those giggles out initially. So, I let the kids know that we're going to say words like vagina and penis, and that these are parts of our body, and that's important to talk about them with puberty. So, saying them up front and giving a little space and time for those uncomfortable giggles that are inevitable to happen, it allows them to just kind of relax and know that you're going to say those things so they don't have to worry about laughing more when they do come up. So I also do that to just normalize puberty as an experience that everyone goes through. So I even tell them that it's something that I went through, which sometimes catches them by surprise. But I like to share also some common puberty related questions and concerns so that when these questions do come up, students are not afraid to ask them. So, this really sets the stage in the beginning to allow students to know that puberty education isn't something to be scared of or feel uncomfortable talking about, and it doesn't have to be weird or scary if it's presented in an appropriate way. So, our next reflection question is I encourage you to brainstorm some ways that you can create this safe and supportive space. So I want you to think of maybe some physical things you can do, like the way chairs are arranged, or maybe the lighting in your room. And also, you may want to learn, or may want to think about how to introduce that concept of guidelines. So spend a few moments thinking about some things that you can do to help students to feel safe and supportive right away. So while you do this, I encourage you to think of that student or that client you have that you know is going to feel uncomfortable right off the bat. What are some things that you could do to make sure that they feel comfortable? So, like I said, I'm going to just pause for a moment to allow you to reflect on this next question. So, our next myth or fact is puberty education typically caters to all genders equally. So, this is a myth that we're going to touch on in tip number 2. So, tip number 2 is to provide gender inclusive education. So you want to ensure that the material that you are teaching, whether you have created it or it's part of a formal curriculum, that it's inclusive of all genders and identities. So these curricula often cater primarily to females and not other genders, which results in misconceptions and confusion around puberty and menstruation for all genders. So, this intervention needs to cater equally to all genders in an effort to reduce any stigma, rumors, or myths, and to promote healthy relationships and friendships, understanding, and respect of each other. So, tip number 3 is incorporating caregivers in the process. You should let caregivers and parents know in some form that you're starting this material and provide some resources that have the same language and terminology that you are teaching the students. So, this really allows caregivers to prepare themselves for the questions that their children are inevitably going to come home with, or going to come home and say, "Oh, my counselor said the word penis," right? So, it's really equipping them and preparing them with these skills. So, some ways that you could do this are sending an email, letting them know that you're starting this material and including some attachments of resources for them. You also could call them and let them know about it. Or, depending on how active parents at your school are, you could host an info night sharing the curriculum and all that it's going to entail for them, and also allow a chance for them to ask questions. So, when I have the conversation with parents, I typically call them to have this conversation with them. So, I work in a setting where students are not all from one district, so it's hard to hold that parent information night. So, I call the parents directly and have this informal conversation with them about what the material is going to hold. So when I have this conversation, I let them know that I encourage them to be reinforcing and educating this at home, and that I do recognize that they are probably teaching this at home as well, but that we do it in school to ensure that all students are receiving this important material. So I let them know that the curriculum we're using and that they can look into it if they want, and also that we are providing students with accurate, age appropriate information about the changes that they will be experiencing during puberty. So I review a little bit about how the lessons are structured with caregivers and the material that we're going to be covering, such as physical, emotional, and social changes that happen during puberty, as well as how we're discussing hygiene, body changes, emotional regulation, and healthy peer relationships. So I usually also follow up with an email with additional information if they want to further this learning at home using similar material and terminology. So, after talking about caregiver involvement, you may have your own feelings around this. So, I want you to take a moment and think of a way that you envision yourself communicating this with caregivers. So, maybe you will do it differently for different caregivers depending on your own relationships with them. So, what are some ways that you can collaborate with caregivers to reinforce this education at home? And how might you address a caregiver that does not want their child to have this content? What might you tell them about that? So I'll pause for another minute to allow you to answer this. And again, feel free to pause if you want to further answer them and I don't leave enough time. So, tip number 4 is to teach empowerment and consent early. So, while I stressed earlier that sex education is different than puberty education, it's important to equip students with knowledge and empowerment of consent as early as possible. So, you want to introduce the concept of consent in age appropriate ways, emphasizing the respect of personal boundaries and the importance of saying and hearing yes and no. So, one way that I like to teach personal boundaries is bringing in a hula hoop and having students put it around them to visually teach this message of your own personal bubble and your own personal boundary. So, I do this by visualizing anyone coming into the hula hoop is in your own personal space, and I empower the students that they can tell someone when and when not to enter into their personal space, as well as how close they allow someone to be. So, in doing this exercise, it's also important to ask the question if everyone's bubble is the same size. So, I like to make sure my students know that someone else's bubble may be bigger or smaller than their own, and their own bubble may change in size depending on who's around them. And that's okay. I like to normalize that concept that it's okay to have a different size bubble for different people in your life. So, this is also teaching students to set, communicate, and respect boundaries in different relationships. So, myth or fact? When teaching puberty education, it's encouraged to use visual supports and bring in tangible items such as pads and tampons. So, this is a fact. And tip number 5 is to use visual supports. So, regardless of the student's age and preferred learning method, when teaching concepts such as puberty, it's important to include clear and accessible visible visuals and diagrams to explain complex challenges in a way that is easier for them to understand. So, some examples of these may be a body diagram representing different body parts and where they are located, and maybe explaining the changes that might happen to them during puberty. So, maybe some examples of this are showing where breasts are and explaining breast growth that happens, or show where the pubic area is and discuss pubic hair growth. So, some other visual aids could be bringing in different types of deodorant and explaining what the difference is. So, maybe a spray, a gel, an antiperspirant, or bringing in menstrual products such as pads, tampons, a panty liner, period underwear, etc. So, some people have very different takes on bringing in menstrual products, but I truly feel that it helps to reduce the embarrassment that people who menstruate may feel when they need to use a tampon or a pad and they fear pulling it out because someone's never seen it before. So, that really breaks down that barrier that we're all seeing it, we're all visualizing it for when it does happen. So, tip number 6 is very closely related to tip number 4, but it's to emphasize bodily autonomy. So, you want to help students understand that their body belongs to them and that they have a say in what happens to it. So, as they get older and start to navigate and go through puberty, they may start to have different feelings within them. And it's important to teach early on that their body is theirs and they control what happens to it. So, another key aspect of bodily autonomy is recognizing how you're feeling in your body and normalizing that you might be having some new feelings in your body. So, I often tell my students that if they get that icky, uncomfortable feeling in their belly, something probably isn't right and that they can verbalize that to a safe adult because they are the expert of their own body. So, another example of how a child may be feeling in their body is that tightness they get in their chest, like it's hard to breathe, or maybe there's a weight on their chest, and that's signaling that they might be scared or anxious and they need to find their safe adult. Tip number 7 is discussing personal safety. If your school or state already has a mandate to do a child abuse curriculum like New York State does, you might already be teaching this concept. However, it's important to teach students about personal safety, especially as they are navigating changes related to puberty. So, discussing personal safety includes things such as discussing safe touches and who their safe adults are. I usually teach that safe touches are ones that occur outside your bathing suit zone, and that ones inside your bathing suit zone should only be done by your doctor and caregivers. But if you ever get that icky feeling in your belly that we talked about before, to make sure you communicate that with a safe adult and to have several safe adults in case one of your safe adults is the one that touches you there. It's also important when teaching personal safety to teach about safe adults and having students identify who their safe adults are. So I usually have students identify a safe adult at home, a safe adult in their neighborhood, and a safe adult in school so that they have one in every area that they may be. So, another key part of personal safety is knowing their personal information, such as parents' phone numbers and addresses. So, one of the most surprising parts to me when I started to teach this content was how many students didn't know their address or their parents' phone numbers. So, I developed this quick little cheat sheet for them So I just made an outline of a smartphone and I included spaces for their parents' name, number, and address. And we filled it in together to make sure that they knew what it was and could write it down. And then also I wrote it down to make sure that it was clear and legible in case they ever needed to reference it. So, myth or fact, students should have the opportunity to ask questions either openly or anonymously. So, that is a fact. And tip number 8 is to allow time for questions. So, it is often recommended that there be numerous options for questions to be done openly or anonymously. Some students have found it helpful to be able to ask anonymous questions. So, when teaching this material, I often pause and I ask if anyone has any questions and I encourage them to raise their hand like normal. But I also hand out index cards in the beginning to allow students to write down questions that they may not feel comfortable asking in a larger setting. So I collect all questions and all index cards because some people might not want theirs collected. However, I collect them all regardless of if they answered a question to avoid any curiosity of who wrote a question, who didn't write a question. And I do screen these and then answer them at a future session to avoid maybe reading one that's inappropriate, but also making sure that I'm answering with the best, most accurate information for their question. So, tip number 9 is to discuss healthy peer relationships. So, a lot of us know from our own early experience with puberty that friendships ebb and flow through this stage of life. And no matter how hard we try to teach this content, it's inevitable that this is going to happen and that friendships are going to change and that people are going to get upset about it. So, before students get to that grueling middle school age, it's important to incorporate healthy peer relationships into puberty education. You want to teach students about healthy friendships, so a friendship versus maybe a romantic relationship, and what constitutes healthy versus unhealthy interactions with friends. I tell my students that healthy friendships are based on mutual respect, trust, and support, and that during this phase of their life, their friendships may shift around, which can make it hard to spot the difference between healthy and unhealthy friendships. I like to review the qualities of a healthy friendship, so respect, trust, support, honesty, and someone that respects your boundaries. So there are several different activities that you can do with this specific area. You can do this with your students or your clients. You can have them discuss healthy friendships and you can group them and have them brainstorm qualities of healthy versus unhealthy friendships. They could brainstorm how a healthy friendship makes someone feel so happy, comfortable, accepted versus how an unhealthy friendship may make them feel. Or you could also create situations and pair students up to have them role play peer interactions and have the other participants in the group identify if this is a healthy or an unhealthy friendship. So, some examples might be a friend sticking up for someone else when there is a bully, or it could be a group of students starting a rumor about another student. So, having them act that out and then identify if it's a healthy or an unhealthy peer relationship. So, our next reflection question is: what challenges do you see that students face today in maintaining healthy friendships and peer relationships? So, you can also comment or add some strategies that you might be able to use to address this when doing this education. So, finally, tip number 10 is to foster emotional regulation skills. So, when teaching all of this content, it can at times feel uncomfortable for students and maybe even feel uncomfortable for yourself. So, it's important to educate students on the strategies to handle the emotional ups and downs that come with puberty, as well as managing some feelings that may arise when they're reviewing this content. So these can be mindfulness, other coping skills, or co regulation techniques. So, with my own students, one of the first signs that we know that they're going through puberty is that we see these sudden emotional roller coasters and ups and downs that they seem to be riding. I have students express that the coping skills that once worked for them are no longer working to manage their anger or frustration, or they feel themselves getting anger faster. So maybe those breathing exercises that used to help them aren't working anymore, and they're getting madder quicker and cannot catch it in time to really focus on those breathing exercises. So maybe practicing with them what it looks like to take a break and demonstrate and role play asking to take a break so it becomes ingrained and is easy to recall when they become frustrated and they know exactly how to do it. So I know that part is definitely easier said than done. It's a battle that I am fighting myself with my own students, but it's truly important to equip students with multiple skills and explain how they can be used at different times. And they may find that as they navigate puberty, some of the skills are no longer working for them. So, really teaching them the importance of expanding their coping skills toolbox and really role playing through these specific coping skills so they can recall them whenever they need to use them. So, moving on from our 10 tips, I just want to stress the importance of puberty education being trauma informed. So I know that trauma informed definitely seems like a buzzword right now, but it's truly not to be overlooked when engaging in puberty education. So when doing education like this, some aspects may be triggering for students, so it is important to have an awareness of that going in. So, a trauma informed model or framework can be defined as a strengths based framework that is grounded in an understanding of and responsiveness to the impact of trauma that emphasizes physical, psychological, and emotional safety for both providers and survivors, that creates opportunities for survivors to rebuild a sense of control and empowerment. So I did not put that definition on a slide because it is something that social workers have been using, and I feel like maybe it's been redundant for some of us, but I will go through and read it again. So, a trauma informed model or framework can be defined as a strengths based framework that is grounded in an understanding of and responsiveness to the impact of trauma that emphasizes physical, psychological, and emotional safety for both providers and survivors, that creates opportunities for survivors to rebuild a sense of control and empowerment. So, that definition I just gave already incorporates a lot of the tips that we previously reviewed. So, empowerment and physical safety and physical well being. So, despite the high number of ACEs or adverse childhood experiences that we know children have, very few puberty or sexuality education curriculum take this into account or advertise as being trauma informed. So, incorporating a trauma informed framework into puberty education allows you to really pair the education material and paying special mindful attention to the trauma that students may have in their past or that they may currently be experiencing that we don't know about. So, it allows us to acknowledge the impact of abuse and the potential and promise of resilience, and the rights of all youth to a positive and healthy well being as they age and mature. So, in finishing this discussion around the importance of a trauma informed puberty curriculum, I'm going to review the 6 principles of trauma informed care, and then I am going to go through them individually. So, these are safety, trustworthiness, and transparency, peer support and mutual self help, collaboration and mutuality, empowerment, voice and choice, and cultural, historical, and gender issues. So, like I mentioned, a lot of these components are already embedded within the 10 tips that we previously reviewed. So, in taking a trauma informed approach to puberty education, this goes beyond just providing the knowledge and equipping youth with the skills. It also includes an open discussion in that safe and empowering environment that we talked about before, and also creating this dynamic where the instructor or facilitator or provider is not assuming that they are the expert in the youth or that they are the expert in puberty, but that they are respecting the youth or student's point of view. So to make puberty education trauma informed, it is not an overhaul of the entire curriculum that you have, and it is not a super big undertaking. It is creating supportive and empowering classroom or practice environment, and also supporting the empowerment and resilience that your students or youth really will have in the end. So I'm going to go through some practical and easy changes to ensure that the content that you are doing is trauma informed and matches the 6 guiding principles. So, like I said, some of the tips on how to incorporate it are ones that we already discussed in our 10 grounding tips to puberty education, but this truly takes it a step further and shows how those tips align with those 6 guiding principles of trauma informed care. So, principle number 1 is safety. We talked about safety in several different tips earlier, but it's important because puberty education can be a vulnerable topic that students need to feel both physically and emotionally safe to engage. You want to use inclusive language to ensure that everyone is seen and respected, and allow for those anonymous question submissions to reduce stigma and embarrassment. And in the beginning, you want to establish clear guidelines and expectations about respect and confidentiality. So, we touched on this before, but you really want to make sure that there's clear messaging that there are absolutely no exceptions to guidelines and that they may then be engaging in this material alone and not in a group with their peers. So, guiding principle number 2 is trustworthiness and transparency. This matters when doing puberty education because students may have specific feelings about puberty related topics. So, trusting the facilitator and their peers that this will be a safe space and also that there's going to be accurate information provided. So you can do this by being clear and honest about what will be covered. So this may consist of an overview of the material or an agenda of what things will look like before diving into the topic. They may want to know what each day will look like and what day you're going to talk about menstruation or anatomy so that they kind of get rid of that anxiety and not think it's going to just pop up at any moment. So letting them be aware of that so it doesn't cause any surprise or anxiety. So, using scientifically appropriate and age appropriate information and encouraging open discussions by normalizing any questions or concerns that may come up also support guiding principle number 2 of trustworthiness and transparency. So, this is our last myth or fact question for this webinar. Thank you for engaging in these with me, and I hope that they helped you stay focused in this. So, myth or fact, group discussion is discouraged during puberty education to prevent misinformation. So, this is a myth that we're going to talk about with guiding principle number 3, peer support. So, this matters because many students may feel alone during this stage in life, but learning together with peers of all genders can help to normalize their experience and to recognize that everyone goes through this. So, ways that you can incorporate this are to facilitate and encourage group discussion through questions and exercises together. So maybe some group building exercises or pairing up to work on an activity as part of the curriculum together. And you can also incorporate this principle by highlighting that everyone experiences puberty differently and at different times. So maybe just because your peers are going through it now and you're not, does not put any blame or any stigma on you, and that you're going to happen in your own time. So, guiding principle number 4 is collaboration and mutuality. So, this matters because when students feel involved and engaged in the learning, they are more likely to participate and absorb or remember the material more. So, you can incorporate this in several different ways. You can give students choice in how they engage. So, maybe if you're asking a question, they could write a response, they could verbally answer, they could draw a response, or you can incorporate interactive activities like I did with the hula hoop, and also allow students to lead and guide the conversations. So, you could have a student ask a question and open it up to others to answer first if it's an appropriate question to answer. So, guiding principle number 5 is empowerment, voice, and choice. So, this matters because this education should empower the students with knowledge and equip them with confidence and give them control over their body and bodily autonomy at a life stage when they might be confused as to what's happening in their body. So you can incorporate this by allowing students to choose their level of participation. Kind of like how I mentioned on the previous slide of writing, verbal, or drawing, you can also allow for a student to pass if a question is asked of them that they don't feel comfortable asking in the moment. You can also provide resources or set aside some time for students to individually ask questions privately or explore resources on their own, and also reinforce that all questions are valid and important. So, guiding principle number 6 is cultural, historical, and gender issues. So, this matters because we don't know all students' past trauma and experiences, and we don't know that we do know that all students are not experiencing puberty in the same way. So, your material and content should be respectful of that. You can incorporate this by using inclusive language. So, for example, saying people who menstruate versus girls or women. So, by acknowledging cultural differences in how puberty is discussed and ensuring that all material represents different identities and experiences. It is also important to note that the inclusive language not have any shame-based messaging when discussing hygiene or menstruation. So I just want to wrap this up, and I want to stress the purpose of puberty education is to help students understand the changes that their bodies may undergo during puberty, to help develop positive attitudes about their bodies, providing knowledge on social, emotional components of puberty, and to promote healthy choices. I wanted to just review the 10 tips that we went over briefly as a reminder. So, when doing puberty education, you want to ensure that you are establishing safe and supportive spaces, that you're providing gender inclusive education, you're incorporating caregivers into the process, you're teaching empowerment and consent early, you're using visual supports, you're emphasizing bodily autonomy, you're discussing personal safety, you're allowing time for questions, you're discussing healthy peer relationships, and fostering those important emotional regulation skills. So, I also definitely recommend and encourage that you're incorporating the 6 guiding principles of trauma informed care into your material and reflecting on your own practice how you can ensure safe spaces in engaging in this content. One other thing that I wanted to add that I do is I have hygiene products like deodorant or shampoo in my office so students don't feel embarrassed to ask for those if they don't have them available at home, or maybe they forgot to put on deodorant that morning. I have several that I purchased from our local dollar store that I just keep in my office so that they're there so students don't need to feel embarrassed if they didn't put any on this morning, or maybe if they feel like they're starting to smell and they haven't had this conversation with their parents yet. I do want to stress that this is only the beginning of puberty education. I encourage you, if you're interested in learning more about this topic, that you do your own research and see what curriculum is out there, see what you like, or maybe adapt some and use your own spin on them. So I want to pause just another minute or two for our last reflection prompt. I want you to write one thing that you have learned today, one thing that you're going to take back and incorporate into your practice, and one thing that you are still left questioning. So, after you're done with this, I do encourage you to go back to that first reflection question and reflect on any challenges that you foresee happening and see if any of those maybe are alleviated by going through this webinar and seeing if maybe some are still left that you feel like are unanswered. So, answer these three reflection prompts, and I'll leave another minute or two for you to do that. So, I want to thank everyone for listening and engaging in this learning and education on this important material to really help improve the puberty experiences for our youth and students. I hope those myth and fact questions were fun and they kind of gave you your twist on your typical webinar. And I also hope that those reflection questions applied meaningful reflection to you on how to best engage in this and how to best do it in your own way that feels comfortable to you. So, like I mentioned in the beginning, I'm a current doctoral student and I'm actively researching puberty education and how to make puberty education trauma informed, and that's part of my program at UB. So, if you want to further this conversation, the best way to reach me is through LinkedIn. You can look me up at Jenilyn Suda, LMSW, or please feel free to scan the QR code on this page that will take you directly to my LinkedIn page. You can also reach out to me via email, so feel free to use either of those methods. And I can't wait to engage in more conversations with you all. And I truly thank you all for listening and taking the time to engage in this important material to help improve the puberty experiences for our youth. So finally, like I mentioned earlier in the webinar, the resources for each specific slide were located at the bottom of each individual slide. However, there is an entire list of resources on these last few slides. So I'll spend these last few minutes just going through these slides to see if there's anything that you are going to look up to further your learning on this important material.
I hope you enjoyed this continuing education course from Agents of Change. Want to earn your CE credits for this course? Visit agentsofchangetraining.com or the link in the description to purchase the course and take the post-test. If you're looking for more CEs, check out our unlimited plan. You will get unlimited access to 150 plus ASWB and NBCC approved continuing education courses for one low annual fee. We're always adding new courses. Did I mention we also have 5 free CE credits available too? Check it out at agentsofchangetraining.com.